Hi, Heather. Thank you for joining me today. For anyone who does not know your work, you are the Professor of Philosophy at the University of Warwick, and your research looks at ethics, beauty, appearance, identity, and visual culture. And your book, Perfect Me, Beauty is an Ethical Ideal, argues that beauty has become more dominant and demanding, and that appearance is increasingly tied to how we judge ourselves and others. And the reason I think this matters for aesthetic practitioners is that clinics are often dealing with much more than just a technical treatment request. A patient or client may come in asking about Botox, filler, skin treatment, or surgery. But behind that request, there may be social comparison, filtered images, fear of aging, relationship pressure, loss of confidence, or the belief that changing appearance will change something much bigger in their life. And of course, that doesn't mean that aesthetic treatment is wrong, but it does mean practitioners need to understand the wider culture their patients or clients are living in. So the question is not simply, can we do this treatment? It may also need to be, why this treatment? Why now? What is the patient expecting? And is this genuinely in their best interest? And that is what I would love to explore with you today. Not an anti-aesthetics argument as such, but a more ethical and I think thoughtful way for practitioners to understand beauty pressure, vulnerability, consent, particularly, and unrealistic expectations. So thank you again for joining me today. And I'd like to open up with this question, please. In your work, you talk about the changing way we value appearance. But what has changed, and why does that actually matter?
So first of all, thank you for having me. Real pleasure to talk to you and to reach some practitioners and who are really at the coalface of this. So absolutely not a kind of anti-practitioner or anti-aesthetics. I'm fascinated by the way that the value of beauty has changed. It's changed absolutely transformatively in the last decade and in the last 2 decades. The way we value appearance now would make absolutely no sense, probably to our parents, but certainly to our grandparents and great grandparents. Appearance has gone from something that was, always something human beings have valued, but something that human beings have valued kind of at the periphery. Now appearance has moved to the core. It's something that we value most, often over our health, which is why it's so important when it comes to things like consent, but also over other things that we think are very valuable, like intelligence. So we're not all wandering around spending our time and money having jabs and treatments to improve our memory or our cognitive capacity. We're spending all our time and money improving our appearance. This is really different from what previous generations did.
Okay, well, that's interesting. And I think I've certainly seen that as well, having been involved in the industry for the last 30 years and running a clinic myself as well. There does seem to be a change in terms of the people that are coming in their expectations, particularly. But, if attractiveness brings advantages in relationships, employment, and social treatment, isn't it just rational for people to value appearance highly?
Part of what makes it so interesting to study this topic is that it is both and, right? So lookism is real. So whether you talk about lookism or appearance discrimination or the halo effect, or to use TikTok language, pretty privilege, it is absolutely true that those who are attractive do better in quite a range of ways. So employment, income, it's it attracts dates, but it doesn't actually necessarily lead to long-term sustained relationships. But even things like, more attractive criminals get less severe punishments, and teachers pay more attention to attractive students. So there are definitely advantages. So yes, it's partly rational, but the advantages are much more limited than the current way we respond to appearance suggests. So it's now the case where particularly young people, but not just young people, perhaps all of us, increasingly believe that if we fix our bodies, we're kind of fixing ourselves, and that will deliver everything. So there's a lovely quote that from a 16-year-old, and I won't get it exactly right now, but it's along the lines of, I think people believe they have to be perfect, that if they're skinny enough, if they're beautiful enough, then their grades will come up, they'll have a great social life, they'll get a boyfriend, so it's this kind of belief that everything will be perfect. Now, of course, your grades won't come up if you fix your body. You actually do have to do the studying, right? If you want to be a lawyer, you have to go and get the law degree. If you want to be a medic, you have to go to medical school, right? So that it's kind of gone from something that, yes, we know it's important, but it's kind of kept within a sphere and often only important for some stages of life and only some of the time, to where we increasingly think it's the most important thing.
Interesting. So in your book, you describe beauty as an ethical ideal. Could you explain in plain terms what you mean by that, please?
Right, so absolutely. An ethical ideal is a value framework. It's the kind of the values around which we structure our lives, our day-to-day practices, our long-term goals. So, for instance, if you are kind of part of the military world and your value ideals might be things like honour and fairness and fair play, and that might change how you behave, and you will expect in the long term that if you live up to that ideal, you will be well regarded by your peers, you will succeed. Lots of religious ideals. So a good Christian will believe that if they, love God and their neighbour enough, they will be rewarded in this life and the next. So by beauty becoming that kind of ideal, we really think that if we succeed at beauty, we will succeed and be rewarded. And we think it is our sense of self. So you can see sorry, you might have to edit this bit because I lost my words. So you can see moral language all over the beauty space. So things like you shouldn't have let yourself go, right? That's a moral condemnation. Or you deserve it. Again, that's a moral reward. Or there's a duty to be beautiful, all the way back to those old songs. Morality is all over the beauty space. And if we fail at beauty, we think that we are failures. And this isn't just a local shame, it's actually a global shame of the self. And that's where it becomes very entangled with morality. So how we do at beauty now makes us feel good about ourselves, positive, deserving praise. When we feel bad, we deserve shame. All of these are really strong signals that it's moved from something peripheral to something central and becoming the dominant value framework and ideal around which we build our lives.
That's really interesting. It's very, very deep as well. But so, I mean, you said earlier, you said our grandparents just wouldn't recognize this. So, and I don't think anyone in this industry would disagree with the fact that things have changed. But what do you think are the main drivers behind this change? And, everyone points at social media, but is that important? Is that one of the main drivers?
So social media has definitely made it move faster, but it's not the main driver. So when I wrote Perfect Me, that was 2018 that book came out. Social media was not anything like it is now. So for instance, at that point, TikTok was only known inside China, and Instagram was still treated as this kind of community building site. So social media and the pandemic exacerbated what was happening, but this was already well in train. So it's really hard to point to the exact causal drivers because social change is so difficult to map like that. But what we can do is point to a number of I talk about a perfect storm of drivers. So one is the technological imperative, right? It's just a case that we can now do so much more to our bodies. And because we can do it, then we do it. It's, so, we often, if I'm teaching, I talk to students about Elizabeth I. So we have this kind of image that she really cared about how she looked, right? We don't know how true that is, but, say she did, there was only so much she could do. So she could, make big ruffs fashionable to hide her aging neck and those kind of things. But there wasn't that much she could do. Whereas now the list of what we can do is extraordinary and everywhere. Another driver is the way that we do consumption now. So we used to talk about the it car or the it bag, and increasingly it's our bodies that we use to show our identity, not us, the stuff that we have. So there's a changing way that we do consumption. The ethical nature I've also, I've already talked about, but that kind of sense that who we are is how we look, and that we spend our time and money on this rather than on other things. So the amount of our leisure time that is focused on our body is really huge. And it's not just the gym and the diet and exercise, it's also a lot of the social activities we do, things like spa days, those kind of things, again, really quite new. And then the final one, and I think this is really significant for how it's changed, is that the beauty ideal is now global. Only for women. For men, the only feature that is global is tallness, but for women, thinness, firmness, smoothness and youth is now global. And that really matters because previous beauty ideals were not. So there were very demanding practices in the past. So you could think about, say, Chinese foot binding or Victorian corset wearing, really demanding and quite harmful practices. But they were obviously beauty practices. So, that tiny lotus foot, only women of a certain class could have that. Most women had to have feet that could help them do their domestic duties and that they could stand on in the fields. So they were always really localized and between cultures. So they always remained beauty and adornment practices. Whereas when a practice becomes global, it becomes invisible and it becomes a health and hygiene practice. And once it's a health and hygiene practice, everybody has to do it, and you no longer recognize that there's adornment going on. So in Perfect Me, I talked about the way that body hair has now become seen as unnatural, abnormal, and even disgusting, right? And it's no longer seen as adornment, it's seen as necessary and normal. And we see that happening across different practices. So things like teeth whitening, again, not necessarily for health, that's all for appearance, but it becomes invisible and becomes health and hygiene. So that all of those things together mean that we're gradually getting this ratcheting up and a normalizing and naturalizing.
Interesting. I'd like to explore the role of images as well, because particularly at the moment with AI as well, where images are filtered, doctored, or modified. But why or how do those images create pressure, do you think, as well? Are they part of it?
Absolutely. We're moving into a visual culture from a text-based culture where the images are really shaping the ideals of who we want to be and who we think we should be. And images seem to be functioning in a way that we don't quite understand. So it's not just that the picture is worth 1,000 words. It's something about bypassing our cognitive ability to recognize what's true and what's not. So we talk about the Instagram face. So the Instagram face is a term that was coined by journalist Gio Tolentino. It's a young face with poreless skin, plump high cheekbones. It has cat-like eyes and long cartoonish lashes. It has a small, neat nose, full lush lips, and is ambiguously ethnic. So this is that kind of plastically perfect face that you see everywhere. It's kind of no pores, no blemishes, no, it's absolutely perfect skin. We talk about glass skin now from the influence of Korean beauty, but the kind of skin that no human being really has. And yet those are the images all around, and particularly the images that we do of ourselves. So everybody knows that images are doctored and modified, and in fact, very many of us doctor and modified our own images. So 85% of girls in the UK under 13 are modifying their images. And there's a lovely series, if you're interested, anybody's interested, to look up Rankin's self-harm photo series. And these are selfies of 13-year-olds. They're given 5 minutes to modify their image before they post it. And the difference is extraordinary. I really recommend looking at those. And you would think, right, you would think that the fact that we modify our own images means that we know it's fake, and therefore we don't feel like we have to look like that, because we know it's impossible, right? We are editing our own selfies. We know that we don't look in the mirror like we look on Instagram. But actually, it turns out that this is what I mean about the difference in the way that images work. Psychologists are starting to talk about it as the boomerang effect, that we see those perfect images, we see our faces in the mirror, and the fact that we know they're altered does nothing to reduce the pressure to look like them. And this is where practitioners are telling me, surgeons are telling me, that increasingly what people are taking into the consulting room are pictures of their own modified selfie as the way they want to look afterwards. So one surgeon has recently called it Snapchat dysmorphia. So I don't know if that will take on, but without a doubt, social media filters are influencing what happens in the consulting room. And nobody can tell you that, oh, we know it's impossible. That doesn't seem to make any difference whatsoever. So I've got a lovely quote here by a young woman in a recent study, not published yet, but she says, I started out with editing on Facetune and I turned into me editing myself.
Interesting. So you've mentioned about like the consulting room and what practitioners are already noticing and recognizing as well. But also in your book as well, you've argued that consent, when you're looking at practical conversations with people who are coming in, may be different for cosmetic procedures compared with medical procedures, even when maybe the technical procedure is similar. So why is that?
This is why I'm so happy to be talking to you today, because from the practitioner's point of view, the procedures might be exactly the same, even identical. And yet from the recipient's point of view, they are really dramatically different procedures. So when it comes to consent in the medical setting, what patients do is they spend a lot of time thinking about the risks. They want to talk to their doctor or nurse about how long the procedures will take, what will the side effects be, what will the recovery time be, and they're kind of making the decision with the practitioner. So usually you've had a diagnosis, you need treatment because there's something that is physically wrong with you, and there will be bad consequences if you don't have treatment. You will continue to be ill and perhaps get worse and so on. So they're weighing up things in real time, often with the practitioners, and they are also balancing something very tangible that they have experienced. So the outcome of the surgery, procedure or treatment will be a return to health, which is a state that they know. Right. When it comes to thinking about aesthetic procedures, right, the research shows that usually people have made their minds up well before they come into the practitioner's surgery. And even when they are told there will be some really terrible risks, by the time they're coming to consent, they are really unlikely to change their mind because they've done all of that work and thinking before they come, especially if it's a kind of something that they've been thinking about for a long time and maybe a quite serious procedure. And what recipients tell us is that at the point of consent, nothing will have changed their mind. They're also focusing almost wholly on the end point. So you can talk about risks. So the person going for medical treatment is thinking predominantly about the risks and the side effects. The person going for the cosmetic treatment is not thinking about the process hardly at all. They're thinking about the end point. And partly because it's kind of this ethical ideal, it's something virtuous. It's good to do beauty practices because it's good for you and it makes you towards your better self. It's like almost no matter what you have to go through to get to that, it's worth it. So focusing on the endpoint means that recipients just don't focus on the risks and the harms.
That's really interesting. So that then poses the question, really, if people are actually making these decisions, you think, before they even enter the consulting room, does consent and the process that we undergo at the moment in clinics still have real value? I mean, what else do you need to do, or could you do?
Absolutely. It certainly doesn't have what we think it has in the medical setting, is that it doesn't provide the same kind of safeguards that we think it does in the medical setting. So the medical setting, the reason that we put so much focus on consent is because ultimately we think that consent will protect autonomy and the best interests of the patient. When it comes to the cosmetic setting, what is in their best interests? It kind of depends what you think that is. But if we look at some of the more serious risks that attach to some procedures, so the most obvious example that lots of cosmetic surgeons and practitioners talk to me about is things like the butt lift, right, which is extreme amount of risk and side effects, and very few people think that is in anybody's best interest, right, unless you have a very exceptionally strong view that people can do whatever they want no matter the risks. Very few people think that. Most of us think that actually, somebody's health, safeguarding somebody's health is crucial. So we shouldn't be allowing people to consent to extremely risky things. And we don't, in many contexts, right? We don't let people take whatever drugs they want. In employment law, we protect people with health and safety. Right? So there's a consent alone in many contexts is not seen as enough. And I think increasingly we're beginning to think that in the cosmetic space, because of the overwhelming social pressures, make it very difficult for people to think about their best interest if what they're thinking about is their health, rather than thinking about this ideal perfect image that they're seeking to attain. That's going to skew their ability to think about the risk factors and other factors.
Indeed. I mean, this is something obviously, one end of the spectrum anyway, that clinics have identified as a potential issue when we talk about body dysmorphic disorder. But from what you're saying, it does seem that many, many, many more patients are going to sit in what we call a grey zone, where it's not diagnosable, but they may be distressed, perfectionist, or repeatedly dissatisfied with treatment outcomes. I mean, how should practitioners think about that group?
I think that's absolutely right. I think the first thing for practitioners to do is to recognise that perhaps the majority of people are now having significant body image anxiety, and that is influencing their decisions. So in a study by the Mental Health Foundation, so one of our biggest UK mental health charities, and this was before the pandemic, it will have got worse. Over a third of UK adults feel anxious or depressed because of concerns about body image, and 1 in 8 have had suicidal thoughts. So that's nearly as many as the 1 in 6 who have suicidal thoughts over overwhelming debt. So there's something really fundamental that has shifted. So when we thought about BDD, not even that long ago, maybe even 10 years ago, right, it was a very small number of patients that had these vastly unrealistic, and now I think it's the case that very many have very unrealistic expectations, unrealistic expectations of the procedure, and also unrealistic expectations of what that procedure will bring to their lives. So I think one of the things that's really to watch out for and talk about is, what do you think this procedure will do, right? Will it give you smoother skin? Will it give you pert breasts? And then will it magically give you a perfect life? Will you magically feel so much better in every aspect of your life? Probably not, right? So there is some evidence that certain procedures will make you feel more confident and have some more self-esteem, but that has to be if you're very realistic about what it is that's changing. So for very many people, it's kind of, I just need to look better. I need to look more myself, right? A procedure is very unlikely to give that. So I think being very clear about what it is that is being offered and what the outcome will be, and lots of, like we use before and after images, right? Often they're quite idealized, but I think when people use those in a very realistic way, that can sort of counter a little bit, because it's still your face, but with some small changes and so on.
Yeah, it's tricky, isn't it, really? Because even with BDD, it can be very difficult to help the patient. And some clinics who refuse to treat people with BDD and recommend that they go and seek advice and support around it. More often than not, what happens, they will go to another premises or another clinic. But, if you're looking at an ethical practice and they are concerned that there is not a good link between the outcome and the emotional benefit, or whatever benefit that there is there that you think is reasonable and rational, what does a good refusal look like in aesthetic practice? How can our practitioners say no without shaming the patient, for instance?
Right. So I think it's very difficult, and I think practitioners are not, while you are at the coalface, all of the responsibility for this should not be on practitioners' shoulders, right? This is something we need to think about as a society. We need to talk about this more. We need to think about it in policy terms. Like we're beginning to think about social media bans very, very late in the day, and that whatever bans we put in place now, that will not stop the appearance genie. The appearance genie is absolutely out of the bag. So I think there's only so much that practitioners can do. So one is about like really ethical kind of use of images and the use of what is promised in the marketing, trying to take enough time with patients so that at least, you can't change what patients understand, but you can try and ensure that you've at least had those conversations. You're absolutely right about the refusal. So lots of practitioners have talked to me, and it's a very common thing that I hear is, but if I don't do it, they will go to somebody else, and they might not go to somebody else that's going to care for them. And that's like the catch-22 of this, right? We're not suddenly going to stop people caring about appearance, but I think that what practitioners can do is just be as clear as possible and take the time, and very many of the things that people do, like cooling off periods and things, those can be invaluable, but I think that for many aesthetic patients, by the time they come to the point, they're not going to change their minds. So it is just about then thinking more broadly, right? How do we educate? What are we doing when it comes to these Instagram filters? How can we sort of change some of the perceptions around it? So, and in the consulting room, I think all you can do is take some time, give as much information as possible, and recognize that images might be helpful in really trying to shape their perspective of what the after will look like, realistic after.
Yeah, that's a useful point, I think. So you mentioned a little bit about the marketing side of things, and of course, as more and more treatments become available in this market, because it is such a huge market, and there are lots of companies looking at to take it, I suppose, advantage of the marketplace as it grows. How do you think clinics can market aesthetic treatments responsibly and ethically, but without reinforcing, if you like, the idea that normal aging, asymmetry, larger body shape or skin textures are some form of personal failure?
Yeah, so again, I think crucial is marketing what it is that's being sold, which is something like, slightly improved skin texture, not improved you, more confident you, more. So, part of it is sticking to the physical, right? What is it that is being, and like in France, for instance, they have to do that by law, right? You have to market just what it is that's physical. So, I mean, obviously it's difficult because you're obviously all competing in a market. So you don't want to be the only one talking about, oh, well, it's about the way that the skin looks, and being very honest about what is necessary for health and what is necessary for other aesthetic improvement. That's one that I think the profession's been talking about for a while now, is being more kind of like it's not the health and well-being package doesn't necessarily all go together, and sometimes if it's just about how you look and it's not going to bring any other benefits, then just making sure that patients know that it's an important value. We've talked about how important it is. There's nothing wrong with caring about appearance and wanting to do things, but let's not missell it as necessary for health.
That's really interesting. John, I wasn't aware of that in France, that you can only talk about like what it does rather than, if you like, that emotional benefit, which of course, when people are looking at marketing, that's really what you need to link it to. It's normally, people buy things because of how it makes them feel rather than just what it does, if you see what I mean. Yeah, so that's like a marketing 101 thing for most businesses.
Yeah. So cosmetic surgery in France is they focused on the advertisement, and it may be one of the reasons that it's less
interesting.
Yeah,
it'd be interesting to see whether that comes across here. I don't know.
Yeah, I don't know if it will, but I mean, it's interesting. So even as you say, everything is marketed like that. So if you look at things like the names of lipsticks, right, they're quite extraordinary. They're things like empowerment, leadership, and so on. So it's not an easy space to be in. And of course, part of what you're doing is selling something. So some of that will be there, but I think it's just like understanding the pressures that people have. I don't think when people buy a lipstick called empowerment, they really believe that. It's kind of part of the package. But when it comes to more invasive procedures, I think people do begin to start believing that.
Yeah. Well, as we know, I mean, words and images are very powerful because that's how we view the world, isn't it? Really, I suppose. So, and people who are selling things know and understand how to utilize those to create action, desire, and sales.
Absolutely. And images are becoming more powerful and words are becoming less powerful. And we don't quite understand why, but this is definitely a feature of the current age. We see it in our politics and all the way across. So the images used are as least as important as the words used.
Fascinating. So, kind of to wrap this up, if you walked into an aesthetic clinic that was taking these issues seriously, what would you expect to see?
So I'd expect to see kind of images that are focused on, like, for instance, like if it's about what's going to happen to your skin texture around your eyes, I would expect to see some pictures around the eye area. I wouldn't expect to see an absolutely a picture of a kind of beautiful 20-year-old on a beach, like, with her big smile and her arms in the air, right? So, I would expect to see it to be more similar to a medical setting than to a hairdresser, right? So what recipients talk about and what young girls now think is that getting invasive procedures, right? If you think invasive procedures might be anything where you break the skin, right? They now think that that's more similar to going to the hairdresser than going to the doctor.
Yep.
And I think that when we have risks attached that are physical risks that you think are more similar to the kind of risks that you would have from a medical treatment, then we should try and re-medicalize those settings.
Yeah, I think that makes perfect sense. But I think the suppliers in the industry also need to be aware of that as well, because again, a lot of supplier marketing uses stock images of beautiful people that again have probably been doctored in some way, shape, or form. The other issue, I'm not even going to open this up and go into it, also is the settings for these, as we know, is increasingly beauty, hair and beauty, where people are having these treatments and so it's become normalized that they go in and have their nails done and maybe have toxin or even worse, gain access to a weight loss drug or whatever. It's like it's a crazy world, but we can't get into that because it's
but I think that might just say that some of that, so what surgeons and practitioners are telling me is the number of negative side effects that we're seeing. So things like, the kind of use of the home lasers treatments, where people are kind of, putting on a serum that shouldn't go with the laser, putting the laser on and then suffering significant burns. We are seeing all kinds of side effects from botched treatments, whether that be from surgery all the way down to like badly used fillers. And that kind of, I think that kind of awareness might gradually spread, especially, public health warnings. Like if you think about how we address smoking, we addressed it with images. All the public health warnings in the world didn't work until we started putting horrible pictures on things. There might be public health things that can gradually be done that maybe we show kids in school, instead of trying to tell them how to be digitally literate. Maybe we show them some pictures of some like very common side effects. Maybe that won't help us.
Which that's an interesting point as you raise it. Funny enough, I saw my granddaughter yesterday. She's 10 years old and she got eye makeup on. I was kind of looking there going, Yeah. I mean, what should or could we say to our children or grandchildren about these treatments and how they view themselves? What could we do?
I think the first thing we say to our children is, very often as parents, we will dismiss appearance concerns. So there are still people that will say things like, oh, it's what's on the outside that counts, and treat beauty and appearance as if it's trivial. Whatever else is happening, appearance in our contemporary world is not trivial, and we must not dismiss children's concerns about appearance and body image as trivial. They know that it's not true. They know that they are constantly judged on how they look, and it's over 90% of young girls and women think that how they look will matter more than anything they do or say. Right? And so the first thing we do is we start listening to our children talking about the way that appearance has changed and trying to take it seriously.
Wonderful. Well, I think I will end it there. It's been absolutely fascinating. You raised a number of points here, and I think given, even more importantly, some practical insights, hints and tips that some practitioners and clinics can take away that they can implement in their own practice. As you say, there's no solution to this necessarily, but I think it's probably just being aware that this is becoming an increasing issue, and for practices that want to treat patients ethically, and particularly as well, I think in a marketplace that is expanding more into health and wellness and looking at mental health as well as part and parcel of that spectrum, then I think these sort of things are very important to be up to speed on. So thank you, Heather. It's been fascinating.
My pleasure. Thank you very much for having me.